So grand rounds have been a part of academic medicine for decades. And whether it is in dermatology, internal medicine, or surgery, these type activities are happening every week across this country. Although grand rounds are primarily considered a teaching activity, the way we view it is that it's also a vital patient care activity. So that through getting the clinical opinions of a number of different physicians at the same time, reviewing their case and their pathology together, the patient can have a better patient outcome.
This is Dermatology Weekly, the official podcast of MD Edge Dermatology, where we bring you conversations with clinical and research experts in the field of dermatology and the latest news in the field of dermatology from MD Edge. I'm the voice of MD Edge Podcasts, Nick Andrews. In episode 64 of Dermatology Weekly, Dr. Vincent DeLeo welcomes Dr. William Huang to discuss the results of a study which showed how patients perceive clinical case viewing sessions in dermatology. That will be coming up after the news portion of our show. For the news portion of our show this week, we're going to welcome Dr. Amy Paller. Dr. Paller is the chair of the Department of Dermatology at the Feinberg School of Medicine in Northwestern University. She's also a professor of pediatrics. Dr. Feinberg came on the show to discuss exactly what's going on with COVID-19 and child and adolescent patients, and specifically their relationship with the dermatologic symptoms that they've seen. MD Edge Dermatology has been covering the relationship between dermatology and COVID-19 for some time now. You can stay up to date, as always, at mdedge.com/dermatology. Dr. Paller, thank you for joining Dermatology Weekly. COVID-19 and these lesions on children and in the setting, and we have case studies and different reports coming out all over the globe. There seems to be some confusion and a need for further research. Can you just fill us in on what's going on and what people are saying?
Well, first of all, we've been having a lot of discussion about COVID toes and their potential association with the COVID-19 pandemic right now. And more recently, a lot of attention has focused on what's now called multi-system inflammatory syndrome in children, or MIS-C, formerly called pediatric multi-system inflammatory syndrome. But this is a syndrome where names and descriptions keep changing. In one case, the COVID toes are really pretty benign and seem to be occurring in individuals who are doing well and have few, if any, signs of COVID-19. And in the other case, we're talking about children who are presenting with multi-system inflammation and actually risk death and require intensive care unit treatment in order to get through their COVID-19.
I've read and we've reported that sometimes it appears as if it's an inflammatory immune response after the body is almost sort of shedding the virus. Is that correct? Or is this part of something that's an active, ongoing case, as you just mentioned?
Yeah, in all of the children that we're seeing, we are primarily seeing what seem to be late manifestations. Some of the, focusing on the multi-system inflammatory syndrome in children, certainly some of these children have tested positive for COVID. The majority have had antibodies suggesting that this is occurring as an inflammatory process during more of a resolution phase. Remember, though, that the COVID-19 virus, the SARS-CoV-2, persists for often a month, finally leaving places like stool is the last place where we tend to see it. And it can be there for a full month to even 37 days before it's out of the system. Now, whether there's much shedding and enough to be detected with those swabs is a different question, hasn't been well studied, but certainly many children are probably past the stage where their nasopharyngeal swab will allow detection by the time that they show this. So we think this is a late manifestation.
One thing I wanted to get was a practical bit of advice from you. So we know that with COVID and coronavirus, everyone has been advised to, when one shows symptoms, to call your provider, your local clinic, and to get advice and to get an appointment at the end of the day. Don't just show up at the emergency department. What would your advice be to clinical dermatologists and to parents for if they see this in their children? What's the move?
So as opposed to COVID toes, where we're telling people, don't get excited about it, just deal with the symptoms if you have them. When we're talking about a condition with shock or macrophage activation syndrome, which certainly many of these are showing, that is an emergency. One of the fallouts of being so concerned about catching the coronavirus infection is the concern about going to see a doctor or getting into an emergency room setting. There's no question that when you have somebody with persistent high fevers and some of these other manifestations, virtually everyone has this non-exudative conjunctivitis. Many are having some peripheral edema, many have the rash, many have other features that can actually look like Kawasaki syndrome. These are not situations in which we want to say, well, let's put it off. We're worried about going to the doctor. Your child needs to get into the emergency room and needs to be admitted to a hospital ASAP.
And this has been presenting, as we've reported as well, the Kawasaki-like presentation of this seems to be the red flag. Is that correct? And you just mentioned?
Well, the Kawasaki manifestations are certainly part of this. Obviously, there are some differences from classical Kawasaki disease in many of these children. Some of them have all the features of Kawasaki disease, but certainly some laboratory features that are a little bit different. This myocarditis, certainly the cardiac dysfunction that's occurring, not typically something that we're seeing in Kawasaki disease, which is more coronary artery disease. That's not to say there isn't coronary artery disease here. There certainly can be, but it doesn't tend to, on the whole, be of the magnitude that we tend to see in Kawasaki disease. So I will say there's some differences, and we also need to recognize that maybe even some of these kids have Kawasaki disease because there's a natural rate of that. But absolutely, this appears to be related to the COVID-19 virus, and this is a medical emergency. Well, I think that it's important to recognize that we are still early in understanding this. And even though we have some pretty firm evidence that this is related to COVID-19, it's not clear why the majority of children handle COVID-19 infection very well. And yet there's this subset, actually seems more in older children versus the younger children who typically get Kawasaki disease, and more in certain racial ethnic groups. For example, in the UK and here, we're seeing a lot of African Americans or Afro-Caribbeans in the UK who are affected by this. And in my experience overall with issues with COVID-19, and also in this group, more boys than girls who are affected. I think these are some very interesting questions that we need to understand better, why certain people are susceptible to this. But you're absolutely right. The most important concept is to be aware of it and to make sure that these children, when they develop this multi-system inflammatory disorder, are recognized immediately and admitted to the hospital, because we also know that intravenous immunoglobulin, systemic steroids, and for many cases, anticoagulants are life-saving. Most of these children do very well when therapy is initiated.
Do we know, I haven't been following what remdesivir has showed in terms of safety for children.
Some patients in the hospital have been given remdesivir. In our hospital, we've had children with COVID-19, and if they're severely affected, for example, respiratory, they're going on remdesivir. So we know that there are children on remdesivir, but we have, at best, preliminary evidence even that remdesivir is helpful in adults. We have no information to understand how valuable it is for children. That said, given the early adult experience, it's important to make sure that extends to kids.
Dr. Amy Powler, thank you so much for joining this edition of Dermatology Weekly. We hope you and yours stay safe, and best of luck to what's going on out there in Chicago.
Thank you so much.
Coming up after the break, Dermatology Weekly returns with Peer-to-Peer and Dr. Vincent DeLeo and his guest, Dr. William Huang. Welcome back to Dermatology Weekly. I am the voice of MD Edge Podcasts, Nick Andrews. A quick reminder that you can get in touch with the show by emailing us at podcasts@mdedge.com. We take your advice and feedback very seriously. We love ratings and reviews on Apple Podcasts, iTunes, or wherever you're allowed to give us a review. Some apps allow you to comment, and if you comment directly with us, we might interact with you. And of course, you can reach out to us on Twitter at MDEdgeDerm. If you have any ideas for topics or guests or what have you, please email us, tweet us, comment on the show, give us some feedback. We do take it very seriously. Okay, without any further ado, it's time now for Peer-to-Peer. Please welcome the host of Peer-to-Peer, Dr. Vincent DeLeo.
So today we're talking to Dr. William Huang about patients' perception of clinical case viewing sessions. Dr. Huang is from Wake Forest School of Medicine in Winston-Salem, North Carolina. Thank you for joining us today, Dr. Huang.
Thank you for having me.
So let's get started. Clinical case viewing sessions, which we commonly refer to as grand rounds patient presentations, are considered an important part of most academic teaching services. So what led you to examine the patient's perspective of this interaction?
So grand rounds have been a part of academic medicine for decades. And whether it is in dermatology, internal medicine, or surgery, these type activities are happening every week across this country. Although grand rounds are primarily considered a teaching activity, the way we view it is that it's also a vital patient care activity. Patients that have difficult to diagnose or difficult to treat conditions are brought in so that through getting the clinical opinions of a number of different physicians at the same time, reviewing their case and their pathology together, the patient can have a better patient outcome. As physicians, we are taught empathy, or the concept of trying to understand and share the feelings of our patients. And with that in mind, we all have a general understanding of how we feel about grand rounds, but we wanted to get the perspective of the patients going through this fairly unique activity.
So can you describe the methodology of your study for us?
Absolutely. So this was a very simple survey study conducted over a period of 6 months. At our institution, which is Wake Forest School of Medicine, we conduct grand rounds in dermatology once every 2 weeks. This is by invitation only from the faculty, although we do accept cases from the community as well. During the study period, we surveyed the patients invited to grand rounds before and immediately after the session and generated descriptive statistics looking at their feelings and also their attitudes regarding participating in this activity.
So what types of patient issues were you trying to examine by the questions you asked?
So we looked at several things, including a patient's willingness to participate again in such an activity, how they felt like a science experiment or guinea pig during the activity, how nervous, anxious, and comfortable they were before and after participating. We also asked, did the session meet the patient's expectations? We also asked, did they feel like they benefited directly from participating in grand rounds? And we also asked, were there any ways that we could improve the overall experience for them? We essentially wanted to get their perspective on being a participant in grand rounds, and we could not find where this had been looked at before in our specialty.
So what did you find is related to the patient's feeling about the endeavor?
Thankfully, in general, the patients felt like participating in grand rounds met their expectations and that they directly benefited from participating, which is great. They were also very likely to participate again, which demonstrates that they had a good experience overall. Anxiety about participating, not surprisingly, went down after they participated, while feelings of being seen like a guinea pig or science experiment went up a little bit.
You know, I find it interesting that you asked about improvements that the patients would like to see made going forward. Can you share their suggestions?
Sure. Most patients stated no improvements were necessary, which means that I think overall we're doing a very good job here. However, some of the suggestions included a bigger room, as these can become very crowded with faculty members and learners very quickly, while others suggested a financial incentive to participate. Others suggested a better explanation just overall before participating, what the actual session would entail, and more involvement of the patient directly.
So, knowing all of this, what changes in the way we do these case viewing sessions would you suggest for our listeners from the results of your study?
Number one, if you do participate in such activities, please be very cognizant of the patient's experience. I think we can easily lose track of that because it is something very routine for us as an activity that we have participated in as medical students, as residents, and as faculty. But for the invited patient, this is something strange, like something they saw on a medical television drama. Second, I would also say communicate to the patient before they are scheduled what this session will actually entail from start to finish to follow-up, so that they understand completely why they are participating, what direct benefit they are getting from this, and when someone will follow up with them with next steps.
I think that's great advice. In this time of COVID and virtual everything, teledermatology, do you ever see these types of events being offered virtually?
Absolutely. That is such a timely question, as you mentioned, during COVID-19, as we continue to conduct our teaching conferences remotely and virtually, and for many of us in healthcare, expand our ability to take care of patients through telemedicine. Anything that can save time and money while still delivering care for the patient and education to our students and residents is more than welcome. Also, it would be great to have greater collaboration across institutions, as technology is allowing us to do that better.
So thank you so much for joining us today. Is there anything else you'd like to add?
I just want everybody who's listening to, of course, be safe and be healthy, and hopefully we get to see one another at a conference soon.
Thank you so much for that, and I totally agree with you.
And that concludes episode 64 of Dermatology Weekly. Dermatology Weekly is produced by MD Edge editors Elizabeth Meshkati and Melissa Sears. The news portion of the program is produced by Elizabeth Meshkati and myself. My guest this week was Dr. Amy Powler. The peer-to-peer portion of the program is produced by Melissa Sears, Tyler Mundek, and Dr. Vincent DeLeo. Dr. DeLeo's guest this week was Dr. William Huang. All MD Edge podcasts are produced by the editor-in-chief of MD Edge and Medscape, Dr. Ivan Aransky, along with MD Edge executive editors Kathy Skarbeck and Mary Ellen Schneider, multimedia editor Terry Rudd, and the producer of social media, Kyla Clark. Dermatology Weekly is engineered, edited, and produced by Tyler Mundek. For all of us here at MD Edge, I'm Nick Andrews. You're listening to Dermatology Weekly.